Hello and welcome back to the Two Purple Carrots blogcast. Today we are going to be discussing tethered oral ties. I'm going to walk you through my entire experience around release procedures, lactation consultants, body work, and how that went for me and my son Luca. And I'm also going to give my opinion about this very controversial topic. So I'll see you in the next episode. There are fewer things in the natural health world that incite such conflict as tethered oral ties and whether to release or not release. You see articles all over the internet with the benefits and drawbacks to each. So I'm just going to share my personal experience with having a release procedure done and what I see as the benefits and potential drawbacks of this difficult decision. So we knew that my son Luca had tethered oral ties basically from birth. From birth, he had a very hypotonic tongue, low tongue posture, and he had difficulty with completely emptying the breast. I was lucky in that I never had pain or mastitis or clogged ducts, but I did have a baby who was constantly hungry because he was not able to really latch deep enough and not able to produce enough suction in order to extract the milk completely from the breast. So he was constantly getting the fore milk and he was constantly hungry and crying all the time. We had no idea this was why he was crying all the time. In the beginning, it was extremely stressful. He would cry 8 hours per day. We had no idea why. We went to several holistic and traditional pediatricians. We searched out several different lactation consultants, and all of them told us that everything looked fine because he was gaining weight. As time went on, his weight gain he was still gaining weight, but at a very slow pace. So he had really started to fall off the growth curve. When he was born, he was around the 55th percentile in weight. And then by the time he was 4.5 months old, he had gotten down to the 5th percentile in weight. And at that point, he was still crying most of the day, very irritable, unhappy. It was extremely difficult to get him to nap, if not impossible to get him to nap, longer than 10, 15, 20 minutes at a time. And so he was also extremely overtired. And so it just made for a very cranky baby. And I'm saying all this because it all related to the tethered oral ties. So around 6 weeks of age, we decided to get his tongue tie released with a practitioner here in Spain. Unfortunately, that practitioner utilized scissors, and I believe that he did not cut the posterior tongue tie, which we'll kind of talk about some of the differences. But Luca did not have an anterior tongue tie. So basically what that means is that if you have an anterior tongue tie, your frenum, the frenulum underneath your tongue, which everybody has, is connected really close to the tip of the tongue. And so they can barely, some babies in really severe cases, they can't even stick their tongue out past their gums. And then none of those babies can stick their tongue out past the lips. And so that is an anterior tongue tie, which he never had. And it was one of the reasons why people consistently told us that he did not have a tongue tie because he could stick his tongue out. But I knew better after reading many books about tongue ties. And I knew that he could also have a posterior tongue tie, which is where the frenulum is attached very tightly to the base of the tongue, which actually keeps the tongue to the floor of the mouth. And that is what I felt like he had because he basically, he could stick his tongue out, but his tongue was always just like stuck to the bottom of his mouth. And because of that, he had this very like hypotonic, very low tongue posture, and his tongue was always essentially like this. So I knew that something was wrong, but everybody just kept telling me it was, kind of in my head because he was gaining weight and I didn't have pain with feeding or any of those traditional things that you would see with tongue ties. But I knew that his tongue posture was not correct, and I knew that his mouth breathing was not correct. And so I kept seeking answers. Anyway, so after that 6-week tongue tie release, nothing changed. His latch didn't change, his feeding didn't change, his behavior didn't change. And we had done, preceding that procedure, many bodywork sessions, what we had available here in Spain, which is essentially craniosacral therapy, seeing an osteopath, seeing a chiropractor. And so we felt like we were as prepared as we possibly could be going into this procedure in Spain. So fast forward to when he was 4.5 months, we saw absolutely no benefit from the first tongue tie release. But I kept thinking, there is something going on. Babies do not cry when they are feeding at the breast. They do not cry this much. Like, there is something going on with this poor boy. We also knew that he had some level of reflux. I felt like it was silent reflux, but you could definitely notice a difference when the reflux would start happening. He could be in a good mood, and then literally like that, his mood would change, and I could just tell, he would have burps, and sometimes you could actually smell the acid coming back up. But he also never vomited that much. He would spit up from time to time, and it did smell very acidy, and it was kind of curdled milk type, spit up, but it wasn't this sort of traditional projectile vomiting or, you could just, tons of reflux. The baby just smelled like acid all the time. None of those things. So it was all more subtle with him, minus, the crying and these sort of behavioral issues and the fact that he never napped. So we sort of continued on this journey. We actually ended up seeing 3 different lactation consultants in Spain, all of which told me that he latched fine and that his feeding was fine. Well, once he finally got down to the 5th percentile in weight, I knew that, we needed to do something urgently. And I have been super opposed to giving formula since the beginning. It's just not something that I would want to introduce for him. That's a different story, but I just don't feel like formula is something that babies should get. So we made the decision to start him on solids. We started him on this soup that I'm not going to go much into depth here because I do have a highlight about it on Instagram. It's called Jaramillo soup, and it's basically, this Venezuelan doctor started feeding babies this highly nutritious soup as basically in place of formula, because he saw a lot of malnutrition in his country. And so we just decided to do that, which was sort of a crazy decision, but I just knew in my mama instinct that this baby was hungry despite what everybody else was telling me. And at that point, we also had the data to show that he was hungry. So we gave him the soup, and literally that first day that we gave him the soup, his behavior improved. He was so much happier with the soup, and he actually went to bed easy, which had never happened before. Usually it was like a 45 to 50 minute torture chamber of trying to get him to sleep by any means necessary. And so that day it was just like this breakthrough, and I was like, yes, this kid has feeding issues, and we need to figure it out. So I mean, the clouds parted, God put his light on me, and one of my followers on Instagram actually reached out to me and asked me if I wanted to speak with her mother, who was a retired IBCLC lactation consultant and who had some expertise in oral dysfunction. And I was like, yes, So this beautiful woman actually, she was on vacation in her hometown of Costa Rica, and she spent an hour with me on a Zoom call, helping me try to figure out what to do for my son. And she encouraged me to reach out to a lactation consultant who was super specialized in oral dysfunction. And so I did, and that's essentially where our journey really started. So I was able to get in with her within 2 weeks, which is amazing because she's always booked up. And our first visit was almost 3 hours long. We went over everything. And she basically confirmed, even by Zoom, she's like, I can't believe that lactation consultants told you that he eats well. She's like, yeah, his latch looks nice from the outside, but you can tell that he doesn't move his tongue. Like his tongue, it was almost always like he just wanted to get his tongue out of the way because he didn't know what to do with it. So it always just kind of sat at his lip. And so even though he would take this wide bite and he would get this really wide latch, his tongue basically did none of the work. And so he was using so much of his cheeks just to try to kind of squeeze the breast in order to extract the milk, that it was not efficient. And so he wasn't getting full feeds. He was getting like an ounce at every single feed. So she basically had us doing a lot of exercises in order to improve the tone of his tongue, the tone of his lips, and in order to prepare him to do the release surgery, because she felt like that was the best option. So we did about 9-10 different exercises 5 times a day for 6 weeks before the surgery. We continued with craniosacral and osteopathic care in Spain, even though I feel like it wasn't this like magic bullet for him. I just wanted him to have some body work. And then we actually flew to the US and we had body work done by an amazing body worker in Atlanta. That really, I mean, it was like a night and day change after every single session we had with her. And so we had a couple of sessions with her before the release. And then we flew to Connecticut to go to one of the best release providers in the country. And we had more body work done in Connecticut by another amazing body worker there. And then I saw my lactation consultant every single day after the release to go over exercises and to make sure that the feeding was going better and things like that. So it was a long, time between from when I knew he had tongue tie issues, which was basically birth, until we saw any sort of improvement or change in him. It's also much, much harder to do tongue tie releases with an older baby. He was 6 months old when he had his second tongue tie release. And when we went to the release provider, he actually ended up doing 7 different release sites. So he had both lips done, his tongue, and then both buckles on each side. So he was really tied, like really tied. And so the idea was that, he was just his cheeks were so tight, his lips were so tight, and his tongue was the posterior tie was so tight, keeping his tongue to the bottom of his mouth, that he was just physically incapable of extracting sufficient milk. I was really nervous about the procedure day, but it was beyond easy. We kind of knew a little bit what to expect because he had a previous release done just on his tongue. And so I knew that it was insanely fast. This particular dentist in Connecticut does it with laser, which is, from what I've seen, the difference between scissors and laser. If you have the option to get a tongue tie release done with laser, go with that option. It's so much quicker. There's absolutely no bleeding. The actual release site is much smaller and it heals much quicker. And it can be much more accurate. So if you have the option, definitely go for laser. So we went literally to do 7 different sites. We were outside waiting for him for 5 minutes. 5 whole minutes. And that's for them to put the numbing gel, put the goggles on him, get the laser ready, and then do the procedure. So it's extremely quick. Afterwards, of course, he cried a bit. I put him right to the breast and he calmed down within minutes. Unfortunately, we had a 2-hour car ride back to our Airbnb at that point. And he did cry in the car some, but he also hates the car. The first 48 hours were the most difficult. They always tell you after a release that within 6 hours or so, they say between like 4 and 8 hours is sort of like the witching hour after a release where they do have some inconsolable crying. We used a homeopathic blend that my lactation consultant had us make before the procedure, which helped a lot. And at about the 6 hour mark is when you have to start doing the wound care. And so that's really nerve wracking the first few days that you do it, especially because the first few days they are a bit tender in the mouth. One piece of advice that was an amazing piece of advice that I got from my lactation consultant is that you actually want to do the stretches more rather than less. So they give you like a minimum amount of stretches that you have to do per day. But I would actually recommend doing it more, because if you think, basically what you're trying to do is keep the wound open when you're doing the stretches. And so if you're going many hours in between doing the stretches, when you go to do the wound care and you lift up the tongue and you lift up the lip, you're essentially reopening the wound every time, which is not what you want because that causes pain. And so we actually did the wound care every 2 hours and then every 4 hours at nighttime, because it was essentially like we were just keeping the wound open instead of reopening it every single time. And so he actually, the first, I think 2 days, I think he did actually have pain with the wound care. One of the reasons, specifically on his tongue, I don't think he had pain in the other sites anymore after the first 24 hours. Under the tongue, because he had had a previous release, he had quite a bit of scar tissue built up. So they had to actually do a deeper release than what they would maybe typically do. And so I do think he had residual pain under his tongue. You can give Tylenol if you want to. We opted out of using Tylenol, but that's a personal decision with you and your baby, looking at the risks and benefits of using something like Tylenol. So we just did it with homeopathics, and I felt like it was honestly sufficient for him. That first 24 hours, you're just going to want to feed like crazy. Breastfeed. I took a bath with him to relax him. You basically just want to do anything you can in order to divert their attention away from their mouth. So it's a lot of all hands on deck those first couple of days. And then after that, honestly, it's really a piece of cake. You're just doing the stretches. If you make a game out of it, honestly, maybe the first 5-7 days he cried during the stretches. I think mainly because you kind of have to hold their arms down and he doesn't like being restricted, not because he actually had pain. And then after that, it kind of just became a little bit of a game and he didn't mind it at all anymore. We would just, lift up his tongue and I would make goofy faces and and Mark would like be holding something and he would be giggling. And so he definitely didn't have pain anymore after the first 48, 72 hours. In terms of outcomes from the procedure, I think ours took a long time to actually see any benefit. I saw an immediate change in the way that he latched. Like it felt completely differently when he latched the very first time after the procedure. So they did the procedure and he basically latched immediately and it felt totally different. At this point, though, we were also competing with the fact that my milk supply had decreased significantly, and I didn't notice it until my milk supply came back. And I was like, oh my gosh, I just can't believe that I didn't notice how much it was dwindling, but I didn't. I wasn't really feeling letdowns anymore, but the lactation consultants here told me that a lot of women don't feel letdowns, and so I was like, okay. And so I was also competing with that. And so I was taking tons of supplements, which helped like crazy. I was also pumping for about 10 minutes after every single feed for a while. And then I was just putting him to the breast like as much as humanly possible. So the more stimulation, the better. And slowly but surely, my milk supply came back. I would say it took, I'm going to say a whole month for us to really see a change in the way that he feeds and his behavior connected to feeding. I would say it's honestly only in the last week that we have noticed a change. And so the first couple of weeks, it was really kind of a dark night of the soul, because I felt like, oh my God, we did all of this. We flew around the world to do this. We went to the best of the best, and it's not making any difference. And we've done, 10 different exercises 5 times a day for months now. We've done all this wound care, 10, 12 times a day, in the middle of the night, waking him up to do this wound care. And it's made no difference at all. And so I was actually really upset. And even just talking to other people, it seemed like their babies improved way faster than what he was improving. But the last week, everything has changed. So we have definitely noticed a ton of changes for the better. And I'm like super thrilled. So first of all, we're noticing that his tongue has elevated like most of the day. I would say 60 to 70% of the day, his tongue is up. And so we're still working. We're still doing oral exercises with him, because his tongue has been like that in utero and now for 7.5 months. And so it's going to take a while to retrain his tongue. So we're still doing exercises, but his tongue is up now. We are working on his lip seal. It is way better than it was before, but that's one of his biggest challenges. And they said it can take up to 3 months for you to see full changes with the lip seal. That's one of the things that take the longest. And then just this last week is when we have started seeing improvements in the way that he feeds and his behavior around feeding. Even like I did a video about my motherhood experience like a week ago, and I was kind of in a bad place. It's crazy how much things can change just in a week. Because this week he is no longer crying during feedings. He used to scream during every feed. He hated feeding. He hated breastfeeding. I would put him to the breast and it was like torture for both of us. He would be on the breast, off the breast, screaming, crying, throwing himself backwards. It was just a terrible feeding experience. Now the feeding experience is so much better. He no longer cries. He still does switch from breast to breast a bit more than average, but that is also improving. He's much more still during feeding. He's not all over the place. I would say now he's a normal 7 to 8 month old baby where they just become more distracted by things. But he's much more still. And the best thing is that he is content after he feeds, which has never happened in the history of his life until this last week. And that alone is worth $1 million to me. The fact that I can feed him and he is content and smiling after the feed rather than pissed off, screaming and crying. And so I feel like this was sort of the boost that I needed to feel like all of this was worth it. And that we are going to continue to see improvements as time goes on. So, time will tell about, the lip seal and how these exercises will do for his full oral function. But as of now, his feeding is amazing. My milk supply has completely returned. And now he is actually, we've noticed a difference in his solids as well. So before we were just giving him soup, which is essentially a puree. And we were very nervous about doing baby-led weaning just because he was a higher choke risk because he didn't have like his oral cavity mapped out. And he couldn't use his tongue to like form a bolus. And so just recently we have started incorporating some solids, and he is actually chewing and doing exactly what he is supposed to be doing with those solids, which is amazing. And I don't think that would have happened if we hadn't done the release. Okay, so that's my personal experience. On the next half, I am going to talk about my opinions around release surgeries. because there's a lot of conflict out there about to release or not release. So I'll see you in part 2. So what I've seen in the natural health space is the conflict that essentially you are causing trauma to the child, and that through body work, myofunctional therapy, craniofacial therapy, you can improve the structure, soften the structure enough to the point where you don't need to do any surgical procedures. I do not share that same opinion, and I'll give you a few reasons why. First is that all of this should be done together. So you can't have a release without having the body work done. You can't have a release without having a lactation consultant on board. You can't have a release without doing myofunctional therapies. So all of this is all for me in the same container, and it's all supportive of the ultimate goal, which is to improve the function of your baby's mouth. What I have seen with people who have done only body work, only myofunctional therapies for fear of traumatizing the child, is that now the child is 3, 4, 5, 6 years old. They have continued problems with feeding. They have continued problems with sleeping. And now you have a 3, 4, 5, 6-year-old who is mouth breathing and potentially now has to have a release procedure that is much more difficult, much more, you have to do exercises for a lot longer, and you are dealing with a longer length of time that kid has had dysfunction that they now have to relearn. So in my personal opinion, the earliest that you can do a release once you recognize that there's a problem, the better. I wish that we would have done it earlier than 6 months. We tried to do it earlier than 6 months, and it was unsuccessful because we went to a not great provider. But my personal opinion is that the earlier you do it, the better, because that's less time that they have learned the wrong way to use their tongue and their cheeks and their lips. And it would have saved us an incredible amount of grief, stress, overwhelm, lack of sleep. It would have saved us so much of that if we would have had a proper release done earlier in his life. So I am very pro early release as soon as you recognize that there's a problem. And I am super pro going to a provider that is going to evaluate all of the possible ties, not just the tongue. So looking at the lips, looking at the cheeks, because I honestly think for Luca, one of the biggest barriers was his cheeks being so tight, from constantly suctioning on the breast like this instead of with his tongue. And so his cheek release actually changed the way that his face looked and actually relaxed his eyes. He used to have 2 little folds here by his eyes, and now he just has the normal 1 fold here. And so it actually changed his facial shape, because all that tension from his face just relaxed, and he kind of got a little more of like a pudgy baby face, which is so great. You can actually feel with his cheeks now when we would do these like stretches with his cheeks before the release, it was always so tight, and the cheeks should be really flexible, flexible tissue. And so now after the release, his cheeks are super flexible the way that they should be. I personally don't think that somebody can do enough CFT, myofunctional therapy, body work in order to release severe tethered oral ties. Perhaps if the baby has a very mild tie that is not affecting feeding, I'm gonna say that again, that is not affecting feeding, then perhaps you could wait and see with body work and myofunctional therapy if it will improve enough that they don't need to have it done. But the whole idea is that people feel like it is a trauma to the child. I personally do not feel that way. It is literally, depending on how many ties you need released, between a 2 and a 5-minute procedure. That includes the prep. That includes them putting a little bit of lidocaine to numb the area. That includes them putting the goggles on if they're using a laser. That includes them getting the laser set up. That was the amount of time that I did not have my son in my arms, was 5 minutes. If they have less, if they only have a tongue tie, for example, the actual release takes 30 seconds, maybe 40 seconds of using the laser. So for me, the potential benefits of a release compared to what they actually go through, especially as a baby, is you have this huge benefit for very little drawback, right? It's discomfort for between 40 seconds and 5 minutes, and then some discomfort for a day or two afterwards, for potentially lifelong benefits in how they eat, how they breathe, and how they sleep. So some of Luca's behavioral issues as well, in my opinion. So yes, he was hungry, and yes, he was overtired, which makes for a very miserable baby, but he was always so tense. Like from when he was a newborn, he came out basically holding his head up, not because he's so advanced in motor skills, but because he was literally so tense all the time that he could not relax his shoulders or his neck because his tongue was, tied to the bottom of his mouth. His cheeks were so tight, causing tightness in the back of his neck. And he was miserable because he was always stiff as a board. We would pick him up and he would be stiff like this, always, constantly, 100% of the time. After the release surgery, it took a while and it took a lot of body work to release that. But before, we would have body work, he would relax, and then he would just tense back up like a day later. Now the body work actually relaxes him and he has stayed relaxed. I have never seen my son move his body the way that he can move his body now, like totally free. He'll actually like lay across my legs, like totally upside down with his head tilted backwards. He would have literally never done that before. He would have screamed and then gotten super stiff and actually sat himself up to get out of that position because he was so tight. And that is all because of the tethered oral ties. So you can do body work and they will relax, and maybe your child will relax longer than Luca did. But in my experience, the relaxation benefits only last a few days to maybe a few weeks. And then all of the tension comes back because the same structural issue is there causing the tension to begin with. So I have never seen personally a baby who has only benefited from doing myofunctional or CFT or any type of other body work and then been able to maintain that through their whole childhood. Again, this is not my area of expertise, but from the feedback that I've just gotten from my following on Instagram, which many of you have gone through this, nobody has been able to maintain that. And many, many people, I would say, a couple of hundred messages saying that they regretted not doing the release when their child was a baby, because now they're talking about palate expansion. They're talking about doing a release now when the kid's 5 years old, and then you have to do all these exercises with a kid who's 5 years old. That they had problems with food, and now they have food aversions because of the way that their mouth didn't work well, and there was a lot of fear around choking. I've known moms who have had to feed their kid on their lap until they were older because the kid had so much fear of choking. They didn't know why that was back then because the kid's a year old and can't say, but would not eat food unless the mom held the kid. And just, working with my lactation consultant who's been doing this for decades and who was like one of the first pioneers in getting releases more mainstream and providing good releases in the States. She completely disagrees that only doing body work or myofunctional therapy can be a solution for the majority of these kids. And she's been doing this for decades. And she's a myofunctional therapist. And she's trained in CFT and CST and many other modalities. And so I just really listen to the experts when it comes to this because they have seen it way longer than what I have, which is approximately 8 months. And just seeing the benefits in Luca make me a true believer that I think releases really need to happen for the majority of these kids. And I'm extremely hopeful that we are preventing a lot of issues in his future as well. So will he need some palate expansion? Maybe, but maybe he needs 3 months of palate expansion instead of 12 to 18 months of palate expansion. Maybe, he had poor sleep there for a long time. He's sleeping so much better now. If we hadn't have had the release done, would his sleep have improved? I don't know, because now he's nasal breathing instead of mouth breathing. We all know the consequences of mouth breathing, which is poor oxygenation. There's even links to like ADHD because these kids are not getting into deep sleep. They're not getting refreshing sleep at nighttime. So then they're having behavioral issues and concentration issues. And so I think that doing a release goes far beyond just the benefits of improving breastfeeding, which is already a massive benefit, right? Because what's the alternative? You pump and give a bottle, and eventually your milk supply dwindles because it's very difficult to maintain a milk supply on pumping, especially after the baby is 5-6 months old. Or you give formula, or you wean and you rely completely on solids, which none of those are a great option. And so, Luca had gotten down to the 5th percentile, and now he's back up to like the 60th percentile. And that is all because we've been doing these exercises, we've done the body work, and we've done the release. Do I feel like it was a trauma for him? No, I do not. Do I feel like it was uncomfortable for him? Did he experience some pain? Yes, I think he did. And that's unfortunate. It hurt my heart. Did I cry? Yes, I did. I cried for both releases. But I knew, I took my Bach flowers, I took my homeopathy. I knew going into it, and I talked about it with Luca. I told him exactly what we were doing and why we were doing it. I knew that what we were doing was right for him and that it would help him in his future with eating, with breathing, with sleeping. And I knew it would strengthen our relationship, because if we could get our breastfeeding relationship back online, it was inevitable that our bond as a mother-baby would strengthen as well. So I do not believe it's traumatizing for babies. I believe there's some pain involved. There's some discomfort involved. Doing the wound care afterwards is a real pain in the butt. It's not fun. It's not fun doing these exercises every 4 hours in the middle of the night and every 2 hours during the day. It's just not fun. It's not fun continuing to do these exercises, but I just make a game out of it. And I know that what I'm providing him now is going to help him so much in the future. And I'm hoping to prevent him having to do so much holistic, orthodontic, and airway care when he's older. So those are my personal opinions, and the opinion of my lactation consultant who has been doing this for over 30 years. And I think most of the people who have been doing this for a long time share the same opinion as I do. And if you have a baby and you're questioning doing it earlier in their life rather than later is so much better, in my opinion. I wish that we had a proper release done at 6 weeks of age. I wish, because I think my entire new early motherhood experience would have changed, to be honest. So I'm really excited to see the continued changes in Luca. And that is my personal opinion on releases. I do recommend going to the best release provider that you can. I do recommend using laser only if you can. And I 1,000,000% recommend having a lactation consultant who is very familiar with oral dysfunction on your team, because the lactation consultant is supposed to be the quarterback of the team. They're supposed to diagnose the tethered oral ties. They're supposed to go with you to the release, or at least be available before and after the release. They're supposed to see you every single day, those few days after the release, or at least the first 48 hours. They're the ones who are supposed to give you the exercises that you do based on your baby's picture. Like Luca has different exercises than another baby because he has different oral dysfunction issues than another baby. And they are the ones that you are continually checking in with to follow progress. And so I see so many people messaging me on Instagram saying, you know, like, what exercises did you do? And what homeopathics did you give? And I'm like, okay, if you're needing to ask those questions to me, then somebody on your team is not doing their job. So find a lactation consultant who is the quarterback of your team. She should be able to refer you to body workers that are good. She should be able to refer you to a release provider that is good. And then she should follow up with your care until your baby gets function back. Okay. So I hope that helps, guys. I know it's a very difficult decision. To be honest, it wasn't a huge, difficult decision for us because I just felt in my mama heart that he needed this. And so just, you know, find that mama instinct and go with what you feel like is right for your baby. At the end of the day, that's the only thing you can do. All right. Thanks, guys. We'll see you later.